Good morning to all. My name is Avneet Kaur. I am a clinical instructor in Khalsa College of Nursing. Today I am going to present a topic, diabetes mellitus. As we know, diabetes mellitus is one of the common disorder in old age people and in our country. If we are talking about the world level statistics, in a worldwide level, 7 to 2 million people are diagnosed with diabetes each year, and from account of that, 72% of them are died due to diabetes mellitus. India ranks second after China in case of diabetes mellitus, and most of people are diagnosed with diabetes mellitus in our country. Besides this, if we are knowing about how to combat this disease and how to manage the signs and symptoms of disease, and with the strategical improvement and management of techniques, we can prevent the mass casualties and disability adjusted life years of the people. So let's commence with the definition of this disease. Definition: diabetes mellitus is characterized as a metabolic disorder. As it is a metabolic disorder, it could caused due to the deficiency of insulin, and besides this, insulin resistance, or maybe they both causes the diabetes mellitus. So before commencing to the disease condition, we have to know about what is insulin. So insulin is a hormone that is produced by the beta cells of Langerhans of pancreas in our body. So pancreas is a digestive organ. If there is any kind of food that we are having, so glucose metabolism is mainly done by the insulin. But there is a no sufficient amount of insulin in our body, or maybe our body's resistance to the insulin, that will lead to occurrence of diabetes mellitus. The most common diabetes mellitus is type 1. So there are various types of diabetes mellitus that are divided into three categories: type 1 diabetes mellitus, type 2 diabetes mellitus, and type 3 diabetes mellitus. Type 1 diabetes mellitus is mainly caused due to the destruction of the beta cells. Beta cells are those cells which are present in the pancreas. So if there could be any disease or there could be any problem in a pancreas which leads to destruction of beta cells, then insulin can't be produced, which leads to occurrence of diabetes mellitus. Second type of diabetes mellitus is diabetes mellitus type 2. This is main caused due to the resistance of our body towards the insulin. As insulin is produced in our normal amount, but our body is resistant to insulin, so that is why type 2 diabetes mellitus is occurred in a person. Type 3 is gestational diabetes mellitus. Gestational diabetes mellitus is occurred in a pregnant woman. The pregnant woman can't produce a particular level of insulin during her pregnancy after a second, third month with pregnancy. That will leads to gestational diabetes mellitus. So these are the three types of diabetes mellitus. So there are various causes or risk factors that will increase our vulnerability to develop this disease. Number one is age. The people that are having a age above than 45 years are at an increased risk of having diabetes mellitus. Second one is ethnicity. The people with having race, African Americans and Asians, they are having a more risk of developing diabetes. Third one is gender. So according to gender, males are at more pronation to having a diabetes mellitus. And next one is fourth cause is obesity. So the people that are having a BMI more than 27 kg per meter square, so those obese patients are at increased risk of developing diabetes. Fifth cause is mainly due to the increased level of triglycerides, increased lipids in our diet, which leads to increased level 250 mg per dl, that will leads to occurrence of the diabetes mellitus. Besides this, family history. Family history is an important component that will leads to diagnosis of diabetes mellitus. As our siblings and parents are having a diabetes mellitus, there are more chances that we may develop a diabetes mellitus. Next are the signs and symptoms and clinical manifestations of the diabetes mellitus. So we have categorized them into three P's. The one P calls for polyphagia. Polyphagia means increased hunger. The patient is having a feeling of increased hunger and wants to eat more and more food. Second one is polydipsia. Polydipsia is increased thirst. As in a diabetes mellitus, there is increased secretion of fluids in a urination, so it will lead to polydipsia, a feeling of thirst. Third P stands for polyuria. Polyuria is mainly due to the increased urination, as these three P's are the main characteristic signs and symptoms of diabetes mellitus: polyphagia, polyuria and polydipsia. Besides this, there are various uncommon signs and symptoms of diabetes mellitus, which are weakness, fatigue, weight loss, and vision changes, nausea, vomiting, and tingling and numbness sensation in our feet. These are the uncommon signs and symptoms that could be present in the patient. And other signs and symptoms included, the patient will be having a wounds that never healed because of having a more glucose in their body. Next are the diagnostic tests, that how can we diagnose the diabetes mellitus. So mainly we are having a 3 tests for characterization of a diabetes mellitus. Number 1 is fasting blood glucose level. As it name suggests, fasting blood glucose level, fasting means the person is not having a meal for 8 hours before having this test. So that if the patient's the level of glucose is exceeding 120 mg per dl, that will lead to occurrence of a diabetes mellitus. Second test is random blood glucose level. Random blood glucose level is a test which is not having any kind of specification of meal time. We can take a sample of blood anytime and that we can check for the level of glucose in that, and if the level exceed more than 200 mg per dl, that will lead to occurrence of a diabetes mellitus. Third and last test that we can detect the diabetes mellitus is postprandial level of glucose. In a postprandial level, we are giving a 75 gram of glucose to the patient in 1 glass of water. After 2 hours, we assess for the glucose level of the body, and that will leads to occurrence of diabetes mellitus. And if the level exceed more than 200 mg per dl, that will diagnosed as patient as having a diabetes mellitus. We have to perform these tests for 3 consecutive days, and that 3 consecutive days will lead to occurrence of diabetes mellitus. Next is management of diabetes mellitus. As diabetes mellitus is an incurable disease, but with the management, with the strategic management and having a management of various factors with their medications, we can combat this disease and reduce any kind of complication in a patient and increase their life expectancy. Number 1 point is dietary management. We have to manage the diet of the patient. As firstly, reduce the carbs and fatty foods in the diet of the patient and increase the vitamins and minerals in the diet. Secondly, we can provide the patient that they can have a mixed flours while they are having a roti and a less ghee diet, and that will provide them to reduce their level of carbs in the food. Third one is food labels. So we could provide them that how they can read the food labels, and that food labels will help them to reduce the level of sugar and carbs. We have to address them that they can't have artificial sweeteners, because artificial sweeteners are also having another mode of sucrose and a fructose in them, that will lead to increased level of glucose and hyperglycemia. Second management is exercise. The patient have to educate regarding that they have to reduce the level of weight that they are having. So weight can be reduced with exercises, and exercise schedule has to be planned, and various exercises such as aerobic exercises, ROM, swimming can be advised to the patients, brisk walking. These are the exercises that would be advised to the patient, and patient can reduce their level of weight and maintain their exercise schedule. Third management is medications. So insulin is the prime therapy that we provide to the patient with diabetes mellitus. So there are various doses of insulin. So categories are characterized as rapid acting, fast acting, slow acting insulins. So they are having their peak onset level and duration of action. Examples are Humalog, Novolog. So these are various substances of the insulin. So there are certain things that the patient and the family member has to be kept in mind while they are providing for insulin. Number 1 is insulin has to be stored in a refrigerator. That will increase the activation and the work of insulin. Second one is, while providing the insulin to the patient, we have to change the position of the position and site of the injection each and every time. The main sites for injection provided is our arms, buttocks area, thighs and abdomen, because there is increased absorption of insulin there, and besides this it will reduce the lipodystrophy that could be occurred for choosing same site for a same day. So this is the main health education that is given to the patient. And third is, to reduce the lipodystrophy, we have to educate patient how can they use a insulin syringe and how they have to discard the insulin syringe. Fourth is oral antidiabetic agents. Oral antidiabetic agents has to be provided to the patients, that are sulfonylureas, bigonides. Metformin is the one of the common drug that we are administering to the patient that are having a diabetes mellitus. DP44 inhibitors, that are sitagliptin, geodiliptin. These are the drugs that has been given in a tablet form to the patient. Besides this, after giving these kind of things to the patient, we have to educate the patient that they have to do a self monitoring of a insulin insulin with the glucometer. So they can make their logbooks regarding the insulin and daily care. So they will have an account of how their insulin is shooting and which drugs are more preferably giving them a relief regarding this increase of glucose. And last are the complications. So complications of the diabetes mellitus are abundance, which will lead to disability adjusted life years. The firstly is hypoglycemia. Hypoglycemia is decreased level of glucose in the blood that could be occur due to the giving them drugs. So for that we have to educate patients. If they are having a symptoms, they can't go for exercise without having any kind of meal. So they should have their meal, they should have their medications, and after that they should have a 3 to 4 high short candies in their pocket. So they will give them a shots while they are feeling a hypoglycemia. Other complications are 3 retinopathies: nephropathy, retinopathy, and peripheral neuropathy. So retinopathies, as diabetes is insipidus in our mainly in our eyes, that will lead to occurrence of vision changes and vision problems. Second is nephropathy. Kidneys get also be destructed if the patient is not having a control of diabetes. Third and last complication is peripheral neuropathy. In a peripheral neuropathy, the nerves of the feet get clogged and that may lead to amputation. Means we have to cut the foot and toes of the patient to prevent any kind of complication. So we have to educate the patient that they have to cut their nails, straighten and file the edges of the nails. Always wear the shoes which in a are comfortable, and they have to check their feet with the mirror on the downside as well for any kind of calluses, any kind of blisters, and they should have a proper feet care. They shouldn't use a very hot water because as we have discussed, there is numbness and tingling sensation, so they will lead to burns in them. We have to provide them perfect fitted shoes. These things will lead to prevent any kind of complication, because the death of the patient with diabetes can occur due to the complications. So with the strategic management, with the lifestyle modification, we can prevent occurrence of these diseases. So this helps to prevent any kind of casualties in our livelihood. Thank you.